Hello, I'm Susan Cadeau. Thank you for being with us. A new poll shows a solid majority of Oklahomans favor State Question 788, which would bring medical marijuana to the Sooner State. Efforts are already underway by legislators to write the rules for medical marijuana, signaling a sense that the issue will likely win voter approval.
62% of likely voters told Sooner Poll they support State Question 788. When informed that a doctor has to write a prescription first, that grew to 73%. Voters will decide the issue in the June primary instead of the November general election. Chip Paul is chairman of Oklahomans for Health.
Doesn't matter to our voters. They'll turn out. They'll turn out. Now, I think who it does hurt is the no voters, to be honest. I think it hurts the no campaign far more than it hurts us.
There is no organized opposition as yet to State Question 788. The most vocal opponent so far is former Oklahoma County Sheriff John Wetzel, who posted on Facebook that it would bring more homelessness, DUI, black market marijuana, domestic violence, drugs in schools, and crime. Claims that proponents of 788 dismiss as the political scare tactics used for decades to justify outlawing of marijuana. Critics do argue 788 is overly broad because it does not contain a list of medical conditions for which cannabis can be prescribed. Paul says they did that for a reason.
We really wanted to create a situation where we force the burden on that physician.
But not many doctors in Oklahoma know the kinds of conditions marijuana can help, so an education effort will be necessary if 788 passes.
The Oklahoma Medical Association. So we are kind of dumping this in their lap, but who else's lap should we dump it in? You know, it shouldn't be ours, shouldn't be the legislature.
On the day the governor announced the date for the vote on 788, U.S. Attorney General Jeff Sessions rescinded the Cole memo, a policy laid out in the Obama administration that detailed how federal marijuana laws would be enforced as states approved medical and recreational marijuana. Former Oklahoma U.S. Attorney Sanford Coates sees Sessions' decision to enforce federal laws, no matter what states have done, will have little impact here.
We've got in our state and every state, we've got, I would say, more dangerous drugs coming in, illegal drugs, methamphetamine being the one that's been the scourge on Oklahoma for decades.
The former U.S. Attorney says the situation may be different in states that have approved recreational marijuana use.
I can't imagine the federal government coming in between a doctor and that doctor's patient. If the state has legalized medical marijuana and that doctor decides that that's the appropriate treatment for his or her patient.
Sean Jenkins is an Army veteran and a board member of Oklahomans for Cannabis. His son, Carver, suffers from intractable epilepsy due to a rare brain disorder. Sean has PTSD from his service in the U.S. Army.
I am prescribed about 2,200 pills per year. It's well known that it takes a toll on my function as far as my liver function and such. They track my blood just for that.
For his son, the medicine he takes does not stop the ongoing brain damage. He suffers from seizures.
So he's prescribed 2 narcotic medications, and neither of which actually, although they help curb and stem seizures, they don't eliminate them. And with every seizure, there's more damage to Carver's brain, and which unfortunately would lead to his demise.
Jenkins says while local physicians believe a marijuana-based medicine would be of more benefit to Carver, the kind he needs is not legal in Oklahoma.
I have found out in the last decade that the little bit of THC actually acts as almost like a key to a lock, and it allows the CBDs, the CBNs, and the other alkaloids that are present to work more effectively and do the job that they were supposed to do. It's helping other people that are like Carver, could help Carver if Oklahoma, and I say if, I think it's more as when the good people of Oklahoma decide to help out their fellow Oklahomans like Carver.
Chelsea Marlette Kennedy heads another group of medical marijuana supporters who have a vested interest in winning approval this coming June.
We are largely made up of patients. I theoretically could be one myself, however, it's against the law and I'm not willing to take that risk. I have lupus and rheumatoid arthritis.
Patients and activists for 788 have seen the dramatic recoveries from the use of medical marijuana, one involving her co-chair.
And it's been amazing for her. She'd done chemo and radiation, and they said there's nothing more we can do for you. And she started on her oils, and she's been in remission ever since.
Bud Scott is the attorney with Vote Yes on State Question 788. He says lawmakers will have to create new laws to regulate planting, quality controls, and a regulatory plan for edibles. But a pair of lawmakers are already working on it.
This has been done before. This was done on State Question 792 with liquor reform, that there were several provisions that were addressed the year before during legislative session that would attach after the vote went through in an affirmative. We could approach that the same way.
Former U.S. Attorney Sanford Coates sees the states moving toward medical or recreational marijuana use as a sign that it is time for a much broader discussion on the nation's drug laws.
I think on a national level, it's really a conversation we need to have. Where are we going with marijuana policy, legalization, and criminal enforcement?
New statistics show that opioid overdose deaths are 25% lower in states that have legalized medical marijuana. It has long been known that marijuana eases pain, but its role in aiding opioid addicts off prescription drugs, while showing some promise, needs much more research. Something that has been hampered by the nation's listing of cannabis as a Schedule I drug alongside cocaine and heroin.